Good evening, everyone. Those prominent voices of caution and worry we've been hearing from this week are being drowned out tonight by a euphoria of sorts as more and more of the country opens up for business and recreation. The anguished tug of war between lives and livelihoods, feeling the pull of a battered economy as a mounting death toll reminds us of the human damage. 88,000 dead so far, 10,000 more lives than just a week ago. And the CDC director late today indicating that all of the models the agency tracks are now predicting at least 100,000 deaths by June 1st. It's a lot to cover tonight. We start with Gabe Gutierrez.
Tonight, as more states reopen, business as usual is anything but. At the Pennsylvania state capitol, not much social distancing by protesters, but the political distance could not be wider. Some Republican lawmakers are urging residents to defy the Democratic governor's shutdown order.
I am not seeing democracy. I am seeing tyranny.
Wisconsin's governor is warning of more deaths after the state Supreme Court struck down his emergency order.
I want my freedom. Basically, I don't think I should be under house arrest.
Cases are rising sharply in nearby Chicago. Authorities say 12-year-old Ernesto Guzman is the area's youngest known person to die from coronavirus.
I just lost my father last week to COVID, and but now it's across the street.
This week, more states ease restrictions. Gyms and pools in Arizona, sports and weddings in Oklahoma, salons and bars in Virginia. Today, at least 5 other states started their limited reopening, including parts of New York like Syracuse, 54 days after its stay-at-home order took effect. During that time, Boyce Murdoch's construction company had to lay off its 22 employees.
To get back to where we was before this happened, I see it being 2 years.
As NASCAR and golf return this weekend for the first time without spectators, several northeastern states have also announced they'll reopen beaches on Memorial Day weekend at half capacity. And tonight, after complaints of packed flights on social media, a major airline is in preliminary discussions to get rid of social distancing efforts altogether. Instead, worried passengers will be allowed to cancel or change flights without fees. Now, the CDC is releasing previously delayed guidelines for workplaces nationwide on how and when to safely reopen. Among the recommendations, promote healthy hygiene practices, intensify cleaning, disinfection, and ventilation, and check for signs and symptoms of employees daily upon arrival. Eric Hicks manages a clothing store near Syracuse University. Today, he opened for online orders and curbside pickup.
We're going to have to get used to maybe not having so much electricity. But I think as time goes on, things will get back to normal, hopefully.
By Sunday, 48 states will have started to partially reopen. Here in upstate New York, authorities will wait at least 2 weeks before moving on to the next phase. Lester?
All right, Gabe Gutierrez tonight, thank you. And as the country moves cautiously ahead on reopening, President Trump was more decisive today, declaring vaccine or no vaccine, we're back, and announcing a new effort to achieve his goal of a vaccine by year's end. Here's Jeff Bennett.
Tonight, the push for a coronavirus vaccine put on the fast track.
We'd love to see if we could do it prior to the end of the year.
President Trump unveiling a new White House effort he says is aimed at developing and distributing a vaccine for the deadly virus.
It's called Operation Warp Speed. That means big and it means fast.
Mr. Trump tapping a 4-star Army general and a former pharmaceutical executive to lead the effort.
I have very recently seen early data from a clinical trial with a coronavirus vaccine. And these data made me feel even more confident that we will be able to deliver a few 100 million doses of vaccine by the end of 2020.
The Trump administration's end-of-year goal outpaces what most experts believe is possible, that it will take 12 to 18 months to develop, test, and produce a vaccine, and that anything less would be a medical miracle.
I just want to make something clear. It's very important. Vaccine or no vaccine, we're back.
Experts say the U.S. will not be able to fully recover from the pandemic until a vaccine is widely available. The president not wearing a face mask during today's Rose Garden news conference, although Dr. Anthony Fauci and Dr. Deborah Birx did.
Why does President Trump choose not to wear a face mask? Does he think it sends the wrong message?
That's his choice. You know, he's tested each and every day.
But there are new questions tonight about the reliability of the test the White House uses to ensure the president's safety. The FDA issuing an alert Thursday night that the rapid coronavirus test from Abbott Laboratories may give inaccurate results, after a new study found it may miss as many as half of positive cases.
If you're testing positive or negative, it can always be double-checked, but it's a very good test.
And the president today again insisted the coronavirus could disappear even without a vaccine, something his own top health advisors have dismissed as unrealistic. Lester?
All right, Jeff Bennett at the White House, thank you. And among the businesses hardest hit are restaurants. And while more of them reopened today, many people are still worried. And some alarming new research shows just how easily the virus might be able to spread in confined spaces. Here's Miguel Almaguer.
Tonight, the cornerstone of small-town America and big city living, the restaurant fighting for its survival. From pizza shops in Colorado,
we can't close the doors, it's a family-owned business,
to cantinas in Nevada.
We're now wearing masks, we're wearing gloves.
As more Americans venture out, new measures are being taken to stop a virus some worry will close 1 in 4 restaurants across the country.
I pride myself in being able to adapt, but this was a new challenge.
The struggle to reopen comes amid a new study showing a loud talker can launch thousands of respiratory droplets so small they can remain suspended in the air for up to 14 minutes. Scientists say in confined spaces, someone who's asymptomatic could quickly spread the coronavirus. In March and April, restaurants took a $52 billion hit. Greg Morris's eatery has been closed 6 weeks.
Without the certainty, knowing that the person next to you is not infected, I don't really know how restaurants are really going to be able to come back in full force.
With some restaurants beginning to see customers again, Japanese broadcaster NHK simulated what would happen if an infected person coughed in their hands, then proceeded to a buffet. Under UV lights, 10 people who shared a water pitcher and utensils had the simulated germs on their hands and face within minutes.
Here in California, to protect customers and employees, restaurants will need to provide disposable menus, suspend the use of shared items like condiment bottles, and provide at least 6 feet of separation.
Many restaurants are also being required to reduce seating, eliminating tables as others install partitions between guests. Tonight, a nearly $900 billion industry, hoping there will soon be an appetite for diners to return to their seat at the table. Miguel Almaguer, NBC News, Los Angeles.
This is Stephanie Rule. As states open, some streets are closing, and Alfresco dining is spilling into them, which means more customers for Tampa's Stone Soup Company.
That allows us to have the space necessary to do what's required, which is, distancing.
It's an effort to help restaurants' bottom lines and attract customers.
My concern is being in an enclosed space. As you eat, you can't have a mask.
This really creates a safe environment for people to feel comfortable getting out.
Florida began allowing dining rooms to be at 25% capacity last week. Next week, it goes up to 50%, but that still won't cut it for many restaurants that have been closed or limited to carryout, like Ilya Goldberg's.
Since COVID, we've been roughly 60 to 70% down.
So Tampa is shutting down streets, part of its pilot program to give restaurants and retailers more space. Some of America's biggest cities close streets to car traffic to help with social distancing. And from coast to coast, despite the risks, more are considering going a step further, exploring ways to let businesses use public spaces.
So expect to see more streets, sidewalks, even parking lots transform into places for shopping and socially distant dining, like this one in New Jersey.
We're willing to do whatever it takes.
Joe Lonnie owns Pep and Dolores in Cincinnati, now serving up Italian food in this tent after being closed for 2 months.
We went from being one of the busiest, hottest restaurants in town to completely shutting down and laying off our entire staff almost overnight.
He's done everything he can to make sure diners feel safe enough to return.
I wish I had that crystal ball and I could tell you that, yes, this is going to be the silver bullet, but at the end of the day, we don't know.
Business now navigating a new path forward. Stephanie Rule, NBC News.
Now to an NBC News investigation. Health officials have made it clear that the key to getting people safely back to work and school is widespread testing. So where does the country stand on testing right now? What Stephanie Gosk found might surprise you.
Who has coronavirus and who doesn't? A simple question, but the answer is still out of reach.
Things have improved. Since April, the numbers of diagnostic tests per day have doubled nationwide. But experts say there is a ways to go.
We're still pretty far away from where we need to be. I believe we should be testing at 3 times the level that we are right now.
The federal government has offered support, but largely left testing up to the states. So we reached out to all 50 to see where things stand. 2/3 responded, the large majority telling us they are not where they need to be. The reasons may be surprising. Plagued at first by shortages, only 4 states say they are low on testing kits, reagents, or swabs right now, though many said they're worried about maintaining that supply. Oklahoma opened its testing up to everyone.
We saw an enormous increase in testing from right around 800 to 1,000 a day to over 4,000 a day. When that happened, we overwhelmed our testing labs.
Multiple states are sometimes competing to get tests processed at the same labs. Oklahoma had to scale back temporarily.
Is it possible right now in the state of Oklahoma for someone who is asymptomatic to go and get a test today?
Yes, it is.
Only a handful of states said they have opened up testing to everyone. The rest are prioritizing those who are sick and essential. But now that capacity has improved, some states are dealing with a different problem, like in Arkansas, where some residents don't realize tests are now more available.
Some people may not see themselves as being at risk, and other people may perceive that they are increasing their risk if they go out to get tested.
There are some health officials who remain frustrated, like in Santa Clara County, California, with a population of 2 million.
The biggest challenge is everyone agrees that testing is absolutely essential, but no one can agree on who's responsible for making sure we have testing available here in the community and beyond.
In the end, experts say the goal is not to test all 330 million Americans right now, but to have the capacity to test where it is needed.
States that are building up their capacity may not be building it up for today. They may be building it up for outbreaks that might pop up down the road.
Absolutely. And every time we see a new outbreak, we need to have the testing capacity to go in, test everybody, identify who's been infected, and isolate those people.
Health officials say they have their eyes on that goal, aware that there is still lots of work to be done. Stephanie Gosk, NBC News, New York.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.